Well, hello, class. My name is Dr. Schmidt. I will be your professor for this course, and I just want to welcome all of you to the class. We are jumping straight in. I will be covering different sections of the lectures each week. This week, I will be covering Chapter 2. But the slides for each of the chapters will be available to you, but I will emphasize the parts that I believe are most important for you to be emphasized. I'll give updates each week. I'll give you key tips and just reminders throughout the week to try and keep you more organized. But let's go ahead and jump into the material as we start today, looking at theory and practice of counseling and psychotherapy. We are going to look specifically as the counselor, as a person and a professional. I have about 2 decades of experience in the areas of counseling in a variety of different contexts. And so I want to give some key insights here as we start this course as the foundation for the theories of counseling. So the most important instrument in counseling, one of the unique things about the role of counseling, is that you are the most important instrument. And so it's very important how you conduct yourself just in a professional setting in general, but just how you live out your life. People, when you sit on the other side of a counseling issue as the actual counselor, you're held to very high regard, and it's very important on how you carry yourself in an ethical, a moral, and a professional sense. It's also very important that you are authentic, not hiding behind your role, not trying to be something that you're not. I think I struggled with this in my earlier days of counseling, of just thinking I had to be a certain way or come off a certain way of what a counselor should look like. And so it's very important that you are authentic in your role as a counselor. And also, it's very important to be a therapeutic person. Most people who get into the roles of counseling are, by nature, therapeutic individuals, but we want to be open and warm and accepting and willing to grow, willing to care for people, willing to be involved with other individuals as well. So these are very key aspects as the role of being, in other words, an effective counselor. There's a lot of research that indicates the centrality of the person as one of the key roles in the outcome of how successful therapy is, and also the therapeutic relationship. So how you are as an individual, the type of therapist that you are, and the type of relationship that you're able to make with your clients has a lot to do in the role of being an effective counselor. Contextual factors, not techniques, are the primary determinants of the therapeutic outcome. So how you are, the setting of it, building rapport in the relationship, these are all key things that are seen in the research that make you an effective counselor, not specifically the therapeutic techniques. A humanistic versus Rogerian versus psychodynamic counselor, we don't see those being as important of factors in how effective counseling is as we do as the contextual things going on, primarily the counselor as a person and the therapeutic relationship they're able to make with their clients. One of the things that is highly recommended, I know it was required for me in many of my counseling courses, is that we, as counselors, it's important that we go through that counseling process. Many of us have been through that counseling process before. That's a lot of the times the things that draws us into counseling. But it's very important that we make sure we spend time on the other side of the counseling chair, as it were, or the counseling desk, that we spend time in counseling. And it's important that we know what it's like to be on the receiving end of that. It'll help you explore your motivations for being a counselor. It also helps you explore things like countertransference, other issues that could be also triggered by clinical work. It's very important to the counselor's personal and professional development that they have that experience on the other side of the counseling. And if we're not committed personally to the value of examining life, this is important. How can we inspire clients to examine their own lives? In other words, if we can't spend time going through the process of counseling, and it's not important enough for us to take the time to go through and really explore the benefits of counseling, then how much are we able to really be proponents of that to our counselees if we ourselves are not able and willing to do that? So very important that for a variety of reasons, personal, professional, practical reasons, that we spend time on the other side of the counseling role. As we reflect on counselors' values, we do want to avoid value imposition. Now, this is dependent, right? A pastoral counselor who's counseling primarily in a church counseling role is going to be a lot different than a person who's counseling being hired by a hospital or a school or the state or the government. But as a general rule, we want to avoid value imposition. In other words, forcing our values onto the individual that's sitting there for counseling. But again, that's dependent upon the role that the counselor is in. However, it is very important to invest time in exploring your personal values and recognizing that none of us are value neutral. We all have a strong sense of values. We all have deep worldviews. We have certain morals and ethics, and that's going to come through in our counseling. Sometimes that's a very good thing, depending on the context, but sometimes that's something that we need to make sure we're very aware of, that we're not imposing that into the counseling setting. So we need to make sure that we can assist clients in creating goals and find answers that are most congruent with their own values. And again, depending on the context of the counseling is going to determine how much this is really playing a role in the counseling process, but we do need to be aware of it nonetheless. How do we manage these value conflicts, especially if we're functioning in a counseling role that requires of us to be very neutral? Well, one thing is bracketing can be very useful in managing value conflicts. You may have heard of this in another way of, it's sometimes referred to as compartmentalizing. Being able to say, hey, this is my values, this is what I believe, I'm going to set that aside so I can look more clearly at what's going on with this particular individual. Because counselors should not refuse to render services to clients because of differing values. Again, this is dependent on the counseling context. I've counseled in churches, I've counseled as a chaplain for the military, I've counseled in the context of schools, and we need to be able to, as counselors, depending on the context, to be able to offer services to those who do not necessarily see eye to eye with our own values. Depending on the role that you play, if you're a church-based counselor functioning hired by the church, that's going to be much different than if you are hired by a school or again, a state institution, to where we can make sure that we are giving those proper objective services to other individuals. And so to do this, seeking supervision by counselors who have been in that role. That's why if you want to be, for example, a licensed clinical therapist or marriage and family therapist, you're going to spend time getting hours accrued and being mentored by people who have done counseling in that context for a very long time to be able to help you as you prepare for that. Being a multiculturally competent counselor is key. It is central. And this week we are going to talk about that. There are some slides that you're going to look at. There's other information that you're going to read in your text reading this week. But just a couple of key points. Become aware of your own biases. I mentioned that already briefly, and I want to bring that up again. Know your biases, know your values, know your cultural norms and expectations. You don't come into a counseling context and just suddenly just mesh immediately, instantly with the other person on all of these things. There's going to be variations of values and cultural norms and expectations. We have to be aware of those. So we must, as competent counselors, attempt to understand the world from our client's vantage point. We have to be very, very careful to not project all of our values, cultural norms, and expectations into their world. We must learn theirs and understand them to be effective counselors. This, again, is somewhat dependent on the counseling context, but nonetheless, it is a general norm that needs to be there in the area of counseling in general. We should gain a knowledge of the dynamics of oppression, racism, discrimination, stereotyping that can exist in another person's particular context and situation. Also studying the historical background, traditions, and values of our clients. Learning from them, we must study them. It is our job as counselors to know our clients on a deep level so that we can truly understand them and help them in the counseling process. We should expand our vantage point to explore our clients' ways of life that are differing from our own. And we have to develop an awareness of acculturation strategies in order to be the best counselors that we can be for our clients. Really quick, some key issues that are faced by beginning therapists, those of you going into counseling roles or people who are just taking this class with looking for a deeper understanding of counseling in the context of doing it as a profession. One is dealing with anxieties. When you go into counseling, if you've never been there before, you will have a time where you just suddenly feel the weight of the world on you. There's a person, they're in need, I'm supposed to help them. What in the world am I doing? What do I even know? Do I even know what I'm doing? This is very, very normal. And we need to learn that that's normal. You will feel that if you haven't felt that, and that's okay. It's a big job to be there and to be in the role of helping another individual with their life problems and their situations. And so anxiety is normal. Accept it, be okay with it, expect it, and that is totally okay. Important to be ourselves, be oneself, and to be self-disclosing, right? To not try and, we talked about that, not be something that we're not. Avoiding perfectionism. If you're an overthinker, like I can be, not walking away, oh, did I do everything right and perfect? What was I saying? Did they know that? To just know that there's not going to be perfection in that. Counseling can be difficult and can be messy. What we need to be is we need to be consistent. We need to be professional. We need to be caring, but we do not need to be perfect. And we need to make sure that we don't hold ourselves to a level of perfectionism that is just really unattainable. Also, with that being said, being honest about our limitations. If we are in over our head, to be honest about that, right? Not to put ourselves down and say that we can't do anything, right? That goes back to the anxieties. Those are going to be there. But just being aware that, hey, this is something that is beyond my capabilities, and being willing and humble to accept that and to disclose that and to have resources that we can then refer people out to if it's beyond our scope of practice. Understanding silence. If you've never been able to sit with a person for a minute or 2 minutes or maybe even 3, 4, 5 minutes in silence, it can be very uncomfortable. But in the counseling process, sometimes it takes a lot of time for people to process things, and that is very good and that can be very normal. You need to understand the value of silence and be okay with silence. Also, with dealing with the demands that can come from clients. People can demand and they can expect a lot out of you. Sometimes people can come into counseling and expect you're going to fix their problems when the reality is they're the only ones who can fix their problems. And you're just there to help assist. And so dealing with that pressure, again, having good mentors and good training in the counseling process is very central to learning how to deal with this pressure that can come from clients. Also dealing with clients who lack commitment. What do you do when you say to an individual that you need to be at a particular place, show up to sessions to do particular homework, and they just don't do it? They're lacking commitment, and they're obviously not changing, and perhaps they might even be getting frustrated because they're not doing the work, and they think that you're just going to fix it without them having to do anything. This is something that can happen. Having good mentorship, having good supervisors is very key to walking you through this, because it is something that will happen in the counseling process. And also, just one other thing too, on this page, tolerating ambiguity. As a counselor, you need to learn to be okay with knowing that all things will not be answered. You will come away at the end of each session saying, we got somewhere, we got something done, but there's so much left unresolved. And a lot of times, every session that you have, you're only spending an hour, maybe a little bit more, maybe a little bit less with an individual. There's only so much that can get done in that time. And just learning that what you're doing is this is a marathon, right? It is not a sprint. Each time you're gaining and you're chipping away at something, and there's going to be a large sense of ambiguity that is there, and to learn to be okay with that as a counselor. Second slide here on issues faced by beginning therapists: avoiding losing oneself in clients. people bring big issues, and they can be very emotionally charged issues, and you can get lost in all that is going on in that person's presenting issues. And so we need to not get lost. We need to remain objective, and it can pull you in. Again, if you've done counseling before, you know what I'm talking about, because this is a very common thing when you can just get pulled into people's problems. We'll talk about that more in this lecture and also in future ones, but you need to make sure that you're finding your boundaries and protecting yourself, because you need to still function as a therapist, right? Getting pulled into everybody's worlds and absorbing that and holding that in as counselors, we're only human. There's only so much that we can do, and that's not good for us. And if we can't function, then we can't be a counselor, and we can't help those who need help. Having a sense of humor is huge. I think that some people just naturally have a good sense of humor, but you need to have a good sense of humor, right? Not taking things too seriously, because again, you need to look at the marathon, not the sprint. You need to be able to see sometimes multiple clients each week, week after week, month after month, year after year. Having a good sense of humor is very, very helpful in that. Sharing responsibility with the client, making sure that it's known what is their responsibility, what is yours, having those clear lines drawn, so that they're not coming in expecting you to fix everything for them. Declining to give advice. Again, this is context dependent, depending on the role of counseling that you do, whether it's church-based or clinical-based or hospital-based or school-based. That's going to really define how much advice really is to be given. There is a time to listen, and to listen carefully, and to decline advice. There's a time to give advice. There's a time to firmly give advice, depending on the counseling context. So that would go to the next point here, defining the role as the counselor. That should be clearly defined at the beginning. When people come to me for counseling as a chaplain, or if they come to me for counseling as a pastor or a pastoral counselor, I'm very, very clear on what I'm going to offer to them, so that there's clear expectations in that counseling process. Also, learn to use techniques appropriately. This is largely the key thing that of why you need to spend 2 years, 3 years, or more learning about counseling. There's so much to be learned in the counseling process, and that's why these degrees can be very robust, and that's why the training can be very detailed and take sometimes several years to be able to get a particular license. And then last, developing one's counseling style. You'll learn when you go through and you get a counseling degree, for example, you're going to study lots of different counseling styles. And you don't come away being trained as a Freudian counselor, as a humanistic counselor, as a Rogerian counselor, as a cognitive behavioral counselor. You learn all of these theories and therapeutic approaches. And ultimately, counseling is largely an art. You take all of that, you show that you are competent in all of those areas of counseling, those techniques of counseling, but you will develop your own counseling style, and that is good, and that is a mark of an experienced counselor when they start taking on kind of their own counseling or therapeutic style. And that's a very, very good thing that will happen over time. Last but not least, and we've kind of talked about this, and let me conclude with this, staying alive. It's a prerequisite to be able to function as a counselor. Take care of your single most important instrument, which is you. I've been in counseling or in counseling roles in the behavioral sciences, like I said at the beginning, for over 2 decades. And I've seen a lot of people not be able to make it in the career field of counseling. It can be very taxing, and it is one that has a high burnout rate. And it is absolutely essential that you learn to take care of you in that process. That is not selfish. If you cannot function as a counselor, how are you going to help anybody? So you must take care of your most important instrument, your most important machine, your most important tool that you have, and that is you and your physical and mental and spiritual health as well. So develop self-care strategies and plan for renewal continuously, just as a general rule for everybody, but specifically for those involved in counseling roles. Know what causes burnout, study burnout, be aware of the signs of burnout, have accountability with other counselors around you to help you watch for these things. and make sure that you're addressing them very, very quickly. So again, knowing how to recognize and remedy burnout, and knowing how to prevent burnout through self-care. There is a lot of help out there. There's a lot of techniques. There's a lot of companies and programs that are there specifically to help counselors with burnout to avoid it and even recover from it. So I hope that is all helpful for you. That was a brief overview of Chapter 2. Make sure you review all of the slides. I'll be communicating with you through announcements and email and through your assignments. And again, welcome to the course. Look forward to seeing all of you. I am Dr. Schmidt, and I will be talking with you all very, very soon.